We ready to go? Can you guys hear me?
Wow.
I don't know if we get that. So, good morning, all. Thanks for coming. My name is Dr. Jeff Jacobson. We are here today to urge Governor Newsom and the state lawmakers to restore the cuts proposed to Medi-Cal dental funding. If those cuts go through, thousands of children across California will lose access to basic dental care. Reimbursements will fall so low that many of us will no longer be able to cover the cost of care. Some providers will have to limit the number of Medi-Cal patients they see. Others will have to stop seeing them altogether. None of us entered this field to get rich. We chose this work because healthy teeth are about more than smiles. They're about speaking clearly, eating without pain, succeeding in school, and showing up with confidence. Thanks to Proposition 56, we've made real progress in expanding access. More dentists join the Medi-Cal program, more kids get preventative care, and in some communities, new clinics have opened their doors. If these funds are eliminated, California will take a giant step backward. Families will be forced to drive hours for care or go without it altogether. This is not a line item you can cut without consequences. Kids who skip regular care like cleanings, sealants, and fluoride end up in hospital emergency rooms in great pain and requiring expensive dental work that places kids out of school and parents out of work. We are calling on lawmakers to protect this vital investment. Please protect Prop 56 funding and help us keep kids healthy. Thank you for your time, and now let me introduce Dr. Karen Feldman.
Thank you, Dr. Jacobson. Hi, my name is Dr. Karen Feldman. I'm a longtime dentist in California who focused her practice on children. I'm here because I'm concerned about the cuts the governor is making to Medi-Cal Dental and what it means to the children across California. Since voters passed Prop 56, we've seen some real measurable progress in California with increases in the dentists participating in Medi-Cal Dental by 30%. This means more access to dental care for kids. Unfortunately, we started from behind. In 2020, a national survey in California rated us 47th in the nation for the delivery of dental care to children. California is the fourth largest economy in the world. How is it possible that we rank 47th in the delivery of dental care to children? The governor's cuts will roll back the small amount of progress made if this continues. There is still so much work to do, and dentists truly believe in this work that it is so important. Parents will do anything to protect their children's health. We are in the middle of building a bridge to reach kids across the state, and we are going to knock it down before it's fully built. Let's also remember that our lawmakers have excellent health and dental coverage. Many of them may not have had the heartbreak of watching their child suffer with tooth pain, and they have no way to get their child to care. Don't don't cut Medi-Cal Dental. Protect what gains we have made and give every child in California the chance to smile. Thank you. And I'd like to introduce Dr. Jan Khalil Kalika, and uh, he'll take it over from me.
Thank you. Good morning. My name is Dr. Jan Kalika. I'm an orthodontist and I practice in Sacramento. My company is called Image Orthodontics. This issue is personal to me. When I immigrated to the United States in 1989, I was one of the patients who was able to receive the care. It really encouraged me to become later on a dentist and contribute my time and energy to UCSF and the overall community. I'm I'm still serving as an associate professor at UCSF. Um, the issue of access to care is very important to me. Part of my master thesis when I was in residency was access to care, to find out that a lot of children, especially in remote areas outside of major cities, have a really big problem accessing care. So it's very important that we continue accessing care and continue providing the health to our children. In the last couple of years, we learned more that the oral health is connected to the overall health, and this connection becomes stronger and stronger. So, to be able to provide preventative dentistry will improve the overall health of our children and create a better environment for all of us in the state of California. So, thank you, and I would like to introduce Estea.
Good morning. My name is Estea Kessler, and I serve on the board of the Central Valley Latino Mayors and Elected Officials Coalition. I'm also a Selma Unified School District Board of Trustee. We represent elected leaders from 8 counties in the Central Valley: Kern, Kings, Fresno, Madera, Merced, San Joaquin, Stanislaus, and Tulare. Our region already faces some of the greatest healthcare access challenges in the state, especially with dental care. I am deeply concerned about how these proposed Medi-Cal dental cuts will harm our already underserved communities. These cuts will force more dentists out of the system. They will make it even harder for families in our Central Valley to find the care they need. As a school board member, I see this impact directly. Kids with untreated dental issues miss school. Missing school means falling behind, struggling to learn, and being held back by pain. But this pain is preventable, as we know how to prevent this pain. Prop 56 expanded access. It helped attract providers. Simply put, it brought kids to see their dentist. It helped them establish good lifetime habits for happy teeth and gums. Today, we are urging the governor to honor the will of the voters and to restore the funding provided for Prop 56. It shouldn't matter where a child lives. They all deserve access to basic care. Thank you. And I want to introduce Doug Kessler.
My name is Doug Kessler, and I'm Executive Director of CISE Puede for Fresno, Kern, Kings, and Tulare counties. We work in the Central Valley helping farm workers and other groups, especially do a lot with the Yemenis community. Our work is focused on helping families and educating families on the challenges they have in healthcare and labor issues. These cuts to Medi-Cal Dental are not just budget cuts, they are justice issues. We're not talking about disproportionately harming low income children and widening racial and economic health disparities. In California, nearly 1 in 4 low income suffer from poor oral health. We should not stand for that in California. Prop 56 marks a turning point. Dentists have been serving families who have been ignored for decades. Slashing medical dental reverses those hard won gains and is a terrible message of fairness in our healthcare system. No child should suffer on the basis of where they live or how little their parents earn. If we believe in justice, then we will all have to chip in to pay for it. And I'd like to introduce Esther Flores.
Good morning. My name is Esther Flores, and I'm here on behalf of the California Farm Worker Foundation. We stand with the thousands of farm worker families across the state who are once again being asked to pay the price of a broken budget. The governor's proposal to cut $331 million from Medi-Cal Dental would strip essential dental care from our farm worker children. Children already facing barriers to healthcare because of where they live, how much their parents earn, and how much the language they speak. 10 counties in California already have no medical dental providers. These families often drive hours to receive cleaning or cavity filled. Now these services may not be there at all. We know what happens when these services disappear. Kids live in pain, they miss school, infections spread, and when things get bad enough, they end up in the ER, costing taxpayers thousands more than it would cost them to have a simple checkup. Prop 56 gave our communities hope. It brought dentists into the system. It began to restore the trust. Cutting the lifeline now tells farm worker families that their children's health doesn't matter. Let me be clear, this is a fight about justice, dignity, and whose voices are heard in Sacramento. On behalf of the California Farm Worker Foundation, I urge our leaders, please reject these cuts. Protect Medi-Cal Dental, and do not turn your back on the people who feed the state. Thank you.
So first, I just want to thank all of you for speaking today, and I want to thank all of you for coming out today. And I just again, please urge Governor Newsom and our state lawmakers to restore the cuts proposed to Medicaid, Medi-Cal dental funding. Thank you.